we have some questions that we can have with these patients. One of the question is, in the same way we consolidate the response with autologous high-dose chemotherapy in the younger population, can we consolidate and maintain the response to this patient? Because usually the DLBCL is not a good candidate to maintenance, because it has not a molecular marker such as the BCL2 in follicular lymphomas or CLL or in mantle cell lymphoma. But with the advent of the evaluation of circulating DNA and the identification of newer molecular marker, maybe we can proceed in that way. We have some small experiences with consolidation and maintenance treatment, for example, with lenalidomide and other drugs, which are encouraging.